Hi there, I'm the neuromuscular mechanic, and today we're going to be talking about steroid injections for greater trochanteric pain syndrome. So what do I use them for? So as the title suggests, we're using them for greater trochanteric pain syndrome. So individuals who are complaining of lateral hip pain focused over the GT that's not responding to conservative treatment. So that would be the indication. Now, with injections that I do, I like to run through a checklist. So important things that we're going to talk about before the videos are ideal patient positioning, the transducer to use, what surface landmarks you can use to identify the GT, and sort of where to put your ultrasound to start, things to look for on your pre-scan, and your target. So let's jump in. So with patient positioning, I'm going to have them side lying with the side of interest on top. So if I'm injecting around the left GT, I'm going to have the left hip sort of on top of the right hip. With the transducer, ideally I want to use a high frequency linear ultrasound probe, but that's often not practical because of the deep nature of these structures, so I'm using a low frequency curvilinear probe. With surface localization, depending on the patient's body habitus, if I can palpate the GT, great. I'll put the ultrasound probe in short axis over the GT. If I can't palpate it, what you can do is you can put the ultrasound probe on the lateral aspect of the proximal femur. And the femur in that case sort of has a spherical appearance. And then if you follow that femur and scan proximally, what you'll notice is once you get to the GT, the GT will be triangular rather than spherical, and it'll often be more superficial compared to the femoral shaft, and we'll look at that. With the pre-scan, we want to look at several structures. We want to look at the iliotibial band. We want to obviously identify the greater trochanter, or GT, and then the tendons of the gluteus medius, which inserts onto the lateral and posterior facets of the GT, and then the tendon of the gluteus minimus, which attaches to the anterior facet. Now, why are these structures important to identify? Well, when we do these injections, we're trying to target the subgluteus maximus bursa, which is underneath the iliotibial band and superficial to the gluteus medius tendon. So we need to know where those structures are for our injection, and we'll talk about how to distinguish that plane. Now with my target, once I've identified it, I'll bring my needle in from posterior to anterior in plane. Because of the depth, I need to often use a spinal needle, and again, it's in between the iliotibial band and the gluteus medius tendon in that fascial plane, which you can differentiate with internal and external hip rotation. So what we've done is we're starting now with the ultrasound probe in short axis over the proximal femur. And so you can appreciate, one, the femur is relatively deep here, and two, there's a spherical nature to the femur. So what I'm going to do shortly is I'm going to take the ultrasound probe and I'm going to scan more proximally. As I go more proximally, one, the bony contours become more superficial, and then two, at this level, you see that triangular appearance, and that is the triangular appearance of the greater trochanter, or GT. And so there we go. That's how you can identify it if you can't palpate the GT on exam to start. So what I'm going to do now is I'm bringing the probe, I'm translating anterior, and I'm just going to pause there, and you can see some of the fibers of the gluteus minimus tendon. So again, that inserts onto the anterior facet. What I'm going to do in the next clip is I'm going to then translate now more posteriorly so that I can appreciate the gluteus medius tendon. So here we go, we're translating more posteriorly. And then we'll sort of freeze there, and you can see the nice hyperechoic definition of the tendon of the gluteus medius that's inserting there. And again, this is really important to identify because overlying this will be that subgluteus maximus bursa, which we're trying to target with our injections. Now what I'm going to do with the next clip is we're going to just sort of change the depth. So we've reduced the depth here. And what I'm doing here to start is I'm internally and externally rotating the hip. And just to show you the overlying sort of hyperechoic structure that's sort of being marked there with the arrow is the iliotibial band. The white, sort of the three white lines that I've joined together, that represents a fascial plane. That's the fascial plane that is overlying the gluteus medius tendon and underlying the iliotibial band. And you can bring that out by internal and external rotation, which is what I'm doing. And you can see they move differently. So you can identify the plane in between. And that is where we want to do our injections. And we refer to that as the subgluteus maximus bursa. So I would bring the needle sort of in the plane of this arrow here. And it's thought and found that injection into this bursa rather than, say, the subgluteus medius bursa is most effective for pain control. So again, here I am doing that movement, which is really important because sometimes you can't see these structures as well, and it's this movement that differentiates the plane. So that concludes the videos. I'm the neuromuscular mechanic, and I hope you found today handy. Take care.